Root canal and cracks and how it shows on an x-ray. This patient presents to us with hurting root canal on upper left. This is tooth number 15. If you look at here, you see this is the root canal filling, which is gutta percha, which is like rubber material. This is a pin, like a metal pin that they put in one of the roots. And here is a filling and here is a crown. I can see here that I don't have any mercury. Sometimes I get these questions, do I have mercury under my crown? This happens to be zirconium crown. But let's say if I had mercury underneath this, I wouldn't be able to tell because it sees metal first. If I have a crown like that, I don't know. If I have a crown like that, I can tell you. You can see it here. It's like darker on the inside. That's where the issues were happening here between the three roots. What we end up doing is extracting this tooth, doing PRF and bone, and basically not replacing this tooth since it was the last tooth. If you have any questions or comments about the crowns and if there's mercury underneath there, leave it in a comment below. This is Natural Cosmetic Dentistry. Come follow us for more. The root canal has to come out. I'm here with Miriam. We were just discussing what to do. She has a root canal on lower right. She had breast cancer about a year ago, did 9 months of regular stuff like chemo, radiation. The cancer went away, but then it came back. We decided we're going to get the root canal out and we're going to replace it later because right now we just want her to get it healthy, and we can actually do a regular bridge which has two supports, one in the back, one up front. If you have questions about root canals, put them in the comments and we will answer. This is Natural Cosmetic Dentistry. Come follow us for more. Some patients want to know, is my root canal tooth that was just extracted actually infected? There is actually such a place that can test this. This is DNA connexons. You can send your extracted tooth here. This is one of our patients. He wanted to know what's inside the tooth. So you can see there's quite a lot of microbes there that do not belong in a tooth. It's kind of interesting test because it's going to tell you also what to do with it and more explanations. For some of you that are skeptical, are the root canal teeth infected or not, you can always find out. There is actually science behind this. If you have any questions, put them in the comments. This is Natural Cosmetic Dentistry. Come follow us for more. Mercury and candida. If you ever have mercury or you had it, you probably have candida unless you have really detoxed your body. Mercury actually holds the candida in the body. That is a mechanism that body has by covering mercury or heavy metal overall with candida. That's why people have those cravings of sugar and such, and they have to have sugar. Some people have constipation, some people have diarrhea. You can have brain fog, you can have irritability. You have to take mercury out of the body first, like in the mouth, and then you have to detox before you can actually get rid of candida. Mercury is there, candida sits on top of it, and then oftentimes people will also get parasites there. They are all friends. They all love each other. If you don't want to have those things in your body, maybe we can help. If you have any questions, comment below. This is Natural Cosmetic Dentistry. Come follow us for more. What comes up a lot with people questions about root canals is, I got root canal, after a while I felt like I was getting brain fog and I got digestive issues. That will be totally valid because root canal, doesn't matter where it is in the mouth, it's going to be affecting your digestion. The bacteria that are sitting inside the root canal, you basically swallow them and they're going to be changing your digestive tract, and they're going to be also overwhelming the digestion. Your belly and your brain are connected. So when belly is not working well, then you're going to get brain fog. But if you do have a root canal and you're having those symptoms, you may want to just look at it and say, hey, could it be coming through the mouth? So it's just something good to know about. If you have any comments about it, put it in the comments below. This is Natural Cosmetic Dentistry. Come follow us for more. Braces and front root canal. The tooth doesn't look cute. She would like to get this handled, but if we are doing something like braces, we need to do braces first. Put teeth in the right position. Braces don't take very long. They are like maybe 9 months. You can see there's like little buttons here, and once this tooth was in a proper position and all her teeth were in better shape, then we decided to extract this tooth and replace it. She had large fillings on those two. Pretty much most of the back teeth were filled. So what we decided to do here, she wanted a bridge. She didn't want an implant. So what she got is basically crown here, and her smile was very cute. Things are possible and you can have a nice smile, but with orthodontics, oftentimes we're going to keep that root canal just for the moment so we get teeth in the right position, and then we proceed with taking it out and replacing it. If you have any questions, leave them in the comments. This is Natural Cosmetic Dentistry. Come follow us for more. What steals your energy in a body? Root canals. A lot of patients that we have here that come with root canal issues, they are very tired. The body is trying to make it alive or keep it alive, so it's going to be putting more energy there. We are electrical bodies. You have brain waves, we have heart waves, we have impulses going up and down. After removal of root canals, a lot of patients will experience actually extra energy in their body. The energy will flow much better. If you're really tired and you have root canals, it Could be the root canals that's causing that. This is Natural and Cosmetic Dentistry. Come follow us for more. How many circuit breakers do you have in your mouth? Body is electrical machine. It uses electrical signals to communicate. It uses like little impulses that jump throughout the body. They go pretty fast. Actually 120 meters per second. Pretty cool, right? You know how it works at home when a circuit breaker pops off. You want to try to turn the light on and off, you can't. Everything is disconnected. That's how root canals can act in a body. They can actually throw off your circuitry, or they can throw off your electrical flow in a body. How many circuits do you have? Well, 28 for most people, because most of us have our wisdom teeth extracted. So if you have any questions about it, put in the comments below. This is Natural Cosmetic Dentistry. Come follow us for more. This tooth had to be extracted. This is our patient that's been coming to our office regularly. This is canine tooth upper left. This is tooth number 11. He's been having a headache for about 2 months, and it gotten worse when he went on a trip in the mountains when he was hiking. We saw that this tooth has indeed died here. There is what we call radiolucency or infection on the tip here. The tooth came out and he healed, but he healed a bit slowly because it was a big defect. Interesting enough, because this is canine, and if you're looking at the energy fields, meridians, it's on the liver, but it's also on your eye. It's called eye tooth. That's where he had his pain, and he didn't even think about looking at dental. If you have any questions, ask them in the comments. This is Natural Cosmetic Dentistry. Come follow us for more. One example of root canal, patient had it for about 10 years, but now it's failing. The tooth is on the lower right, on the molar, second from the back. That actually lays on energy field of long and large intestine, which is your digestive tract. And he had some issues there. He had a couple of colonoscopies and a couple of issues there with polyps. This root canal has been here for 10 years. That is the life expectancy for a root canal. So you can see a lot of decay here. The fill is a little bit short. Ideally should be all the way to the bottom. What we see here is the infection. So you can see this darkening around here compared to this tooth, which is a live tooth. This looks all nice here. There is bone around here, and over here you can already see that there's less bone here. This is more dark looking, and this is air. You can see air is dark. What we have decided is just to extract this tooth and replace it with a bridge. He already has a crown behind, and in front of it he has a large filling. I think he'll be more healthy. If you have any comments on it, leave it below. This is Natural Cosmetic Dentistry. Come follow us for more.